afternoon. My name is Paula.
Hi.
How are you feeling today?
I'm okay.
So, I'm here to give you your suppository, as earlier on you mentioned to the doctors that you were having problems with constipation. So, am I getting your consent for the administration of suppository?
Yes.
Okay. So, Julie, since you have given me your consent for the administration of suppository, I will just ensure that the bedpan, commode, and the toilet is readily available if you need it, okay?
Okay.
So I will just be preparing the equipment and I'll come back when I'm ready with the equipment, okay? Thank you. So I'm gonna perform my hand hygiene. And I'll be wearing my PPE. I just have to advise you regarding the position for us to insert the suppository, okay? So I need for you to, if you need me to assist you, just tell us. But if you can, you're able to do it on your own, then please feel free to do it, okay? So I just need for you to lie on your left lateral side, and then I just need for your knees to be flexed. Your feet could be elevated or raised as well, and I just need for your backside or your buttocks to be near the edge of the bed. Okay?
Okay.
Alright. So you're in the correct position now. So I need to put the incontinence pad just underneath your hips and buttocks. Are you just able to lift your buttocks for us, please?
Yes.
Okay. So Julie, before I give the medication, I just need to confirm the prescription as well. So I'll just put back the blanket, okay?
Okay.
So Julie, before we start, can you please tell me your name and date of birth as I counter-check it with your wristband and my documentation?
Yes, Julie Saunders, 1/1/1988.
That's correct. Do you have any allergies to food, drugs, or latex?
None.
So that's also correct. So what you verbally said is correct according to your ID band and the document. So I will be reading the prescription now. So I have here prescription for Julie Saunders. Date of birth is the 1st of the 1st, 1988. I'm just going to check that all the addressograph have the same details. So hospital number is 1234567X. Ward is surgical assessment unit. Date of admission is today. Height is 1.62 meters. The weight is 70 kilograms, and the body surface area is 1.77. Your consultant is Dr. A. Richards, and admission time is 10 o'clock. So your prescriber is Dr. M. Jones with GMC number 3214213 with signature and bleep number. Previously, medication was administered by Tommy Fig with initial signature and ward number as well. So there's no known allergies as you've confirmed earlier on. Moving on to the next page. You've had some ondansetron as a stat dose earlier on. So how are you feeling? Are you feeling nauseated or feeling sick as well?
No, I feel better.
That's good. So just tell us if you need any of those medications again. So moving on to the next page, there's no prescribed oxygen for you. No prescribed antimicrobials as well. Moving on to the next page. For regular medication, no prescribed regular medication. You've got atorvastatin, 80 milligram, which is prescribed for 10 o'clock tonight. Then moving on to the next page. For your as required medication, you have here glycerol suppository, prescribed today, the 1st of the 2023. Dose is 4 grams. Frequency is once a day for rectal. Duration is for 7 days. Time is for 12 noon. Start date is today, 1st of 2023. Finish date is for 6 days. It is prescribed by Dr. M. Jones with signature and bleep number. So I could confirm that this prescription is valid, signed for, and legible. So the medication I'll be giving you for 12 o'clock is your glycerin suppository, okay?
Okay.
Do you have any questions for this?
None so far.
None so far. Okay. So before I give you the medication, Julie, some side effects of glycerin suppository would be rectal irritation, abdominal cramps, or sometimes mucus in the stool. So we just have to observe for those side effects, okay?
Okay.
Right, thank you. So I'm quite happy to give you the medication because we have confirmed the prescription. So I need to check my equipments as well, okay? So I have here my disposable tray, which is visibly clean, dry and intact. I'm happy to use that. I have here my sterile lubricating jelly, water soluble, dry and intact packaging, expires 4/2026. And I have here my glycerin suppository, as prescribed, for 4 grams, dry and intact packaging, expires 11/2028. And I have here my gauze, just to help with lubricating the suppository, dry and intact, happy to use. Now I'm just gonna get a new set of non-sterile gloves. Right, so what I'm going to be doing is I'm just going to get the suppository, open it, put it in the gauze, and lubricate it with the jelly. In the gauze. So Julie, are you happy to proceed?
Yes.
So right, I'm just gonna have to move the blanket just to expose your perianal area. Also checking for any signs of skin swelling, soreness, excoriation, hemorrhoids, rectal prolapse, or infestation. So there's none. So I'm happy to insert the suppository now, okay?
Okay.
So first, I need to separate your buttocks. Separating the buttocks. And then, as manufacturers advise, I'm going to insert the suppository, the correct side, and advance it 2 to 4 centimeters. Right. And I'll just make sure to wipe the excess and then just cover back. So Julie, I have inserted the suppository. It's only 4 grams, so I inserted only 1 suppository. So I will just have to request for you to just keep lying on your left lateral side for 20 minutes or until you could tolerate. And I've left the incontinence pad in just because you might feel some discharge. It's just the medication or the suppository melts inside the rectum, okay? So right, so if again you got the buzzer there, if you need any assistance, I will be able to help you to go to the toilet or commode if you need to, okay?
All right.
Right, so just secure that you have the blanket on as well, just for your privacy and dignity. So I'll be disposing of my equipment as well and my PPE. And do my hand hygiene as well. So again, Julie, thank you for your time. I will just be documenting that I have given you your 12 o'clock suppository prescribed for you.